Have you ever wondered why it takes so long to get to a diagnosis of Alzheimer's disease or another type of dementia? Well, the good news is that it should take a bit of time because dementia and Alzheimer's disease are a diagnosis of exclusion, which means we've ruled out any other issue that might be reversible. So it's a little bit more complicated, but in today's episode, I'm going to walk you through the types of tests, exams, and screenings that should be done by your provider to get to a diagnosis. And stay tuned to the end to get your free checklist of things that need to be done from my website, MelissaBPhD.com. Welcome back to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse practitioner, and I wear a lot of different hats in my work, including hosting this weekly podcast to bring you news and information on aging, caring for someone living with Alzheimer's disease, and a wide range of topics that I hope will help move us towards becoming an age-friendly world. Because when things are age-friendly, they're friendly for everyone. So if you like the podcast, the best way to help me grow and support the podcast is to like it, share it, and leave a review in whatever platform you've tuned in on today. Because no matter how old you are today, we are all aging, and these issues are going to become increasingly important. If you're a millennial, there are things that need to be in place when you reach the age of 65. So we have about 20 to 25 years to get these things in place to help you age with the support and choices that will help you, just like the people that are 65 today. Your likes, shares, and reviews help get the information out to help more people dealing with these issues. But right now, let's get going on this week's episode. Welcome to This is Getting Old, Moving Towards an Age-Friendly World. I'm Dr. Melissa Batchelor, and I am a nurse practitioner with over 25 years of experience working with older adults and their families. Be sure to subscribe to the podcast. Be sure to like it, share it, and leave a comment or a review on whatever platform you're listening to. And if you're on YouTube, you can actually now become a member to support the podcast and get early access to each of my episodes each week. And you can also join my community on Facebook. It's called This is Getting Old, Moving Towards an Age-Friendly World. But that's a place where we can connect and you can give me feedback and suggestions for upcoming episodes. But now let's talk about how Alzheimer's disease is diagnosed. So what we need to do in the beginning is investigate any possible cause. And early diagnosis is really important because right now there is no cure, but there may be an underlying cause that's either treatable or reversible, like maybe it's your thyroid or you're anemic. But when you're also diagnosed early, it gives you time to make lifestyle modifications that actually could help manage the disease. Secondly, it helps to explain why you're having a harder time with your memory or decision making. And thirdly, it lets you make decisions about your future and communicate your desires to your family and friends. And unfortunately, there isn't like a single test that can tell you if you have Alzheimer's disease or a related dementia or a blend of both, which is called mixed dementias. Any type of dementia is a diagnosis of exclusion. So we have to do a lot of different tests to make sure there's not something else that is causing the problem with your memory. So the 6 categories are: we're going to do a history, a physical exam, we're going to do a medication reconciliation, we're going to do cognitive screenings, blood work, and then a brain scan. So let's break this down. So for your history, the first part of this is your social history. And so this has a lot to do with your lifestyle factors. And so these are actually modifiable risk factors, but have you ever smoked? Do you smoke now? How much alcohol do you typically drink? How much exercise do you get each day? How much sleep are you getting? And that's pretty much what a comprehensive social history is going to ask. Also, like, have you had any recent deaths in the family? Do you feel isolated from other people? How are you kind of functioning socially? And all of those things can give a provider an indication of some other things that might be going on with you besides just physically when you're in the office. The second part of a history is your family history. So do you have a family history of heart disease or diabetes or Alzheimer's disease? Because your family history, while your lifestyle factors and your social history is a bigger impact, knowing your family history is important. So the provider should ask about that. The next part of a history is your medical history. So what chronic diseases do you have? Do you have a history of high blood pressure, diabetes? Have you had cancer? And then what were the treatments for each of those things and how well controlled are they? The next part is your surgical history, because a lot of times with older adults, you can end up having what's called a delirium. That's basically something that happens because you went under general anesthesia. And the way that you would know it was more of a delirium is that you were fine yesterday, you had the surgery, now you're not. So that's usually an indication of delirium. And in geriatrics, we have the 3Ds, which are depression, dementia, and delirium. So we need to make sure that you're not experiencing a delirium. But typically, if you're in there to see like your primary care provider, it's been a while. But delirium can last up to 6 months. So it is something that it is part of your history that we need to know about. So kind of like, when was the last time your memory was fine is another important question. And then lastly, doing a review of systems. And so this is where they should go through and ask you questions, kind of think about from your head to your toe. Are you having any trouble with your vision? How is your hearing? When was your last eye exam? When was your last hearing exam? When was the last time you went to the dentist? Are you having any pain? So it just kind of goes on and on. Shortness of breath, how are you sleeping? But they should ask you either it might be a paper that you fill out before your visit, but there should be some review of kind of all of your systems, heart, brain, gut, musculoskeletal, everything. The next part is your physical exam. So this starts with vital signs. So you need to know what your blood pressure, your pulse, what your pulse oximetry level is. So knowing what your vital signs are, and they may even do like a finger stick just to find out what your blood sugar is doing. If you have been tracking any of those things at home, you need to be sure that you are bringing those in to your provider. And then your provider should do a head to toe exam. And this includes looking in your ears to make sure that you don't have a wax impactment, because earwax can actually make it really hard to hear. And that's easily removed in the office, or they can give you something to take home to clear that up. If you have hearing aids, are you wearing them? How well do they work? And then doing visual tests, because sometimes if you are having like sensory changes with hearing and vision, they can mimic a memory problem, and it's just because the person can't see you or hear you. Or if someone has had those issues and they have not been treated, that can actually lead to memory problems. So making sure that there's a full head to toe exam that's done. The next part is called a medication reconciliation, as well as deprescribing. And so what we want here is that you need to bring in every prescription medication, every over-the-counter medication that you're taking, every vitamin, supplement, anything that you are taking. You need to put it in a bag and bring it to your provider, because they should make a comprehensive list of every medication, supplement, or over-the-counter medication you're taking, and why you're taking those things, and then looking to see if any of them could be deprescribed or stopped, and if any of them are contributing to your memory problem. I just did an episode recently about 7 medications to avoid, but even something as simple as taking like a Tylenol PM or a Benadryl can increase your risk for falls, and it can impact your memory, as well as other prescription medications. So you can have your provider go through these to see if there are any drug-to-drug interactions, drug-to-supplement interactions, and then just making decisions about if any of them are unnecessary, or if one of them might be a culprit for your memory problem. The next set of screenings that need to happen are your cognitive screenings. So again, they should be screening you for depression. And this could be, again, a paper that you fill out. At the very least, they should ask you if you have been feeling sad or blue for the past 2 weeks or longer, because depression can actually look like a dementia. And I remember I had a lady come in one time and her clock drawing was terrible. We did all of these, all the screenings and testing that I'm talking to you about now. And at the end of the day, her problems really began a couple of months after she lost her husband. And so I was telling her daughter, I really think what we need to do is try to treat this depression first and then bring her back. And within 6 weeks of being on an antidepressant, her clock drawing was fine and her memory was fine. So you do want to be sure that you're getting an accurate diagnosis and someone's not just making an assumption that because you're older that you have dementia or some type of Alzheimer's. So making sure they're screening you for depression. And then the screenings for memory issues are actually based on 6 different parts. The first is orientation. So that is, do you know what the day, the date, the day of the week, what month? Do you know where you are? Like what doctor's office, what city? So how oriented are you to those things? The second part is language. And so this has to do with verbal fluency and naming. So if I ask you to write down, as many words as you can think of that start with the letter F in 1 minute, how many of those words are you able to write down? As well as looking at a picture and being able to name what that picture is. Some of like the Montreal Cognitive Assessment is one of those exams where sometimes educational level and life experience can matter. Like one of the images you have to pick out is like a camel. But, my grandmother had a 4th grade education. I don't know that she'd ever seen a camel before. So sometimes you have to do this is why these are called screenings, and questions need to be asked because they can give you a different set of animals or whatever it is to recognize. Like, do you know what this is? Well, it's a watch. Most people can get that because most people have seen watches. So the third part of it is reason and computation. So this, you may have noticed your loved one, or maybe you are having more trouble dealing with numbers. So how well are you able to do math, and not necessarily just in your head, but in the way you've always done calculations? Can you subtract 100 minus 7 is what? 93. What is 93 minus 7? And you'll go through a series of those where you're having to do that calculation. And the other part of it is abstraction. So my family and I play Connections. I think it's a great brain game in addition to Wordle, because you are having to look for the abstract connections to those words. It's a Wall Street Journal free game that you can play. But that's the type of thing. Or if I gave you like a metaphor, could you tell me what it means? Like, for example, a rolling stone gathers no moss. Like, what does that mean? The next part is visual spatial ability. And that's a really kind of fancy word that just means, can you look at a 3D image? So the image of like a cube, 3D, can you look at that image and recreate it? Or could you, the other part of it is like a clock drawing test. Can you put the numbers on the face of the clock and then put the hands facing, the hands in the direction of whatever time you're told to do that? As we move forward in today's society, and people use digital watches, I'm not sure how good that's going to be as a test, because you could tell someone write down 310, they might just write a 3 and a 10, but you're supposed to be able to. What we're doing is looking at your ability to plan and write down, like, is the 12 at the top, the 3 and on this side, the 6 on the bottom, and then your 9, and then fill in all the other numbers? Or do you do you put all 12 numbers in just the first quarter of that clock? If they do it that way, it's a sign of a visual spatial issue. The next part is executive function. So this is problem solving. If I were to give you, a problem and ask you how would you solve that problem? That would be important, or even ask you an order of kind of how you would do things. So that tests executive function. And then memory it typically has to do with like registration and recall. So if I were to tell you 3 words, can you repeat those 3 words back to me? And then I would go on with asking you other questions, and then I would circle back and say, what were the 3 words that I asked you about? And if you can't remember what those 3 words are, that's like a recall issue, meaning like you can hold information for a short period of time, but maybe not for longer than that. So 3 of the most common exams that are done like in an office setting would be a mini-cog, a mini mental state exam, or an MMSE, or the Montreal Cognitive Assessment, or the MoCA. I did find one this week that is available online. It's called the Self-Administered Gerocognitive Exam. And you can just Google that word, but I'm going to put a link in the description below and on my website, MelissaBPhD.com, for this episode. So you can click on that link, and there's an online version, or there's 4 other versions that you can download and take the test. And they say it doesn't matter which version of it you ask, or which version of it you take. The important thing is just taking that so that you have a general idea if you were to self-administer an exam like this, or at home if you want to administer that to a loved one. It is a free online resource. It's called the Self-Administered Cognitive Exam, but you'll notice that it goes right through orientation, language, reason, visual spatial ability, executive function, and memory, because all of them have that in common. The next part of getting to a diagnosis is blood work. And again, this needs to be a comprehensive panel, from like a complete blood count to look for anemia or an infection, anything underlying that. A basic metabolic panel to look at your electrolytes, your kidney function. They need to be checking your thyroid, your B12, your folate, because again, deficiencies or irregularities with those tests, again, point to a problem that's not really an Alzheimer's issue. It's another chronic condition that we need to treat and manage. And so your provider should do like a full workup based on you and kind of your history, and they will make those decisions to make sure that they're checking all of your lab values as well. And then the last part are some brain scans. And the options here, you can get a head CT or an MRI. What these are looking for is actually your brain structure. What those exams or what those tests can do is they can tell us if your brain has been shrinking. It can, which is more indicative of like an Alzheimer's type dementia. It might tell us if you've had like some small strokes. That would lean more towards like a vascular dementia. A PET scan is another option. That's where they use a small amount of radioactive substance to measure your brain activity. And it can also measure abnormal protein deposits in the brain. So that might be helpful for some other types of dementia. And then the last type is called a SPECT. It's a single photon emission computerized tomography. And this is basically a nuclear test that looks at blood flow and activity. So are there parts of your brain that are either overactive or underactive? And depending on what those are, that might give us an indication of whether it's like an anxiety or a depression issue. If it is something structural, that's going to show up as well. But not as many people do those SPECT scans, so it might be harder to find one of those near you. But it's always something that you can ask your provider for and find out if your insurance covers it. So that is a really quick overview of how Alzheimer's disease is diagnosed. And you can get your free checklist as well as some other resources like the 10 warning signs. But both of these things you can download for free. MelissaBPhD.com/diagnosis checklist is where you can get the list of the 6 things that we just talked about. And there is a hyperlink on that document to the 10 warning signs checklist, as well as the episode about the 10 warning signs of Alzheimer's disease. And the episode right before this was about 7 medications that you need to avoid to improve your brain and not cause any problems related to the Beers criteria. So again, I'm Dr. Melissa Batchelor. You can go to my website, MelissaBPhD.com, to sign up for my newsletter. Feel free to become a member right here on YouTube. Be sure that you subscribe, like, share, leave a comment, because all those things do help get the word out to other people, as well as improve the ratings of the podcast. You can join my Facebook community called This is Getting Old, Moving Towards an Age-Friendly World, where you can give me feedback and give me ideas for episodes that you would like for me to talk about. But that's one way that we can interact with each other. And otherwise, thank you so much for tuning in, and I will see you next week. Have a good one. Thank you so much for listening to this week's episode. You can check out other episodes on this platform or visit my website at MelissaBPhD.com. Thanks to listeners like you, in the first 18 months of This is Getting Old, we have reached a ranking of top 10% globally, and I cannot tell you how much I appreciate your support in making that happen. I'm also really excited to let you know that you can now work with me directly, either one-on-one or you can join one of the groups that I coach. Particularly if you're an adult child dealing with an aging parent or a caregiver trying to manage the complexities of someone living with Alzheimer's disease. In the show notes, you can also find information about how to reach out and contact me directly, and I hope to work with each of you very soon as we discover and share more ways to make the world more age-friendly for everyone. My website also has information about how to contact me for speaking engagements or if you have someone you'd like to recommend as a show guest for This Is Getting Old. If you have a product or service in the aging space that you would like to advertise and or sponsor an episode, there's more information about that on my website. And you can also find books and courses that I developed and learn more about the products and services that I recommend. So don't forget, if you like the podcast, the best way to help me grow and support it is to like it, share it, and leave a review in whatever platform that you've tuned in on today. Your likes, shares, and reviews help increase my rating and my rankings, and also help other people find the podcast. I look forward to reading your reviews and hearing from you.